Moving on to the next topic, I would like to invite the chairpersons, Dr. Preeti, who's the diabetologist in Dr. Preeti's Diabetes Care Center, and Dr. S.G. Harish, who's the senior consultant physician and diabetologist at Spurs Hospital, Bengaluru. Over to you, chairpersons.
I think just to say a few words about Shunmugavelu, sir. I think the first time when I saw him is about 20 years back in ADA, American Diabetic Association annual conference, and he asked a basic genetic question, and the person, who is a renowned person, I don't want to take a name, on the dais said, instead of saying I don't know the answer, he said, this is out of scope of my talk. And that is the talent this man has. And big round of applause for Shunmugavelu. Thank you.
Thank you. Thank you, Dr. Srinivasamurthy, for your nice introductions.
Over to Chair.
First of all, I would like to thank Dr. Srinivasamurthy for having provided me an opportunity to chair this session. And greetings from Spurs Hospital, R.R. Nagar. I would like to introduce Dr. Shunmugavelu, who is a very famous physician, consultant physician in diabetology at Trichy. He practices at Trichy Diabetic Systopathy.
Sir, that is enough, sir. That is enough. I'll continue my talk.
Please.
Yes,
the stage is all yours.
Yes, respected chairpersons, senior doctors, my doctor friends. I'm here to make a presentation on benefits of intermittent fasting in obese and patients with diabetes, with a particular focus on evidence-based findings. I thank the chairperson for their kind introduction. Also, thank Dr. Srinivasamurthy for his kind invitations. My disclosures, what I'm going to do for another 18 minutes. The contents of my talk line includes introduction, physiology of intermittent fasting, description of the interventions, intermittent fasting, weight loss, fasting, insulin-resistant diabetes, pre-diabetes, safety, as well as the cardiovascular risk and intermittent fasting, feasibility and caution, and conclusions. So obesity and Met syndrome are a growing problem. There has been increasing interest towards improving the dietary patterns through various nutritional regimens. Intermittent fasting is one that has been proposed due to its benefits on weight management, cardiovascular health, and oxidative stress. So ancient practices and beliefs. Fasting is known to be the most ancient traditions in the world that has been practiced among various communities for either cultural or religious reasons. It has also been used as a healing method for diseases. Hippocrates wrote, to eat when you are sick is to feed your illness. And ancient Greeks believed that fasting improves cognitive abilities. So several ancient Greek writer wrote many things about the fasting. The best of all medicine is resting and fasting. So finally, fasting is widely practiced for spiritual purposes. Caloric restriction, reduction in total caloric intake, has been found to result in reduced body weight as well as increased longevity in many fishes. Next is physiology of intermittent fasting. There occurs a metabolic switching. The glucose fatty acid cycle. The phosphate cycle has 4 stages: fed stage, post-absorptive state, fasting state, and long-term fast state. Glucose is the primary energy source for most tissues during the day. After meals, glucose is utilized for energy. Fat is stored as triglycerides. During prolonged fasting, triglycerides are converted to fatty acids and glycerol, which are metabolized for energy. Liver converts fatty acids to ketone bodies, which occurs during fasting. It becomes a major source of energy for many tissues, especially brain. So the fed and post-absorptive states are the only times relevant to normal eating. In the intermittent fasting regimen, individual often goes through the fed state, post-absorptive state, as well as the fasting state. Insulin is the main driver in the feeding state, whereas the body uses glucose as a fuel. In the fasting state, glucagon is the primary hormone, and the body uses liver stores of glycogen. There occurs a metabolic switch. The point of negative energy balance, at which liver glycogen stores are depleted and fatty acids are metabolized, typically occurs beyond 12 hours after the cessation of food intake. So the metabolic switch from utilizing glucose to fatty acid, that is fatty acid derived ketone, it represents and trigger shifting metabolism from lipid cholesterol synthesis to fatty acid oxidation and fatty acid derived ketones, preserving the muscle mass and function. So we are going to see 3 types of patients. Pattern A. When individuals consume 3 meals plus snacks every day, the metabolic switch is never initiated and there is no ketone bodies at all. And the total utilization of glucose is much higher. So pattern B. Person who fasted completely one day, then had 3 separate meals on the subsequent day. So 1 day fasting and 1 day 3 meals. On the day involving fasting, ketones are progressively elevated and glucose levels are consistently low, whereas on the day with food consumption, ketones remain low and glucose levels are elevated, right? Next is, this is a pattern, highlights example of person who consumes all their food within 6 hours. So morning 10 to evening 4, or morning 10 to evening 6, like that. Remaining 12 hours, 14 hours, 16 hours, they remain fasting. So in this case, the metabolic switch is flipped during the following 12 hours of fasting, remains on for approximately 6 hours each day until food is consumed after approximately 18 hours of fasting, right? So physiology of intermittent fasting. So the metabolic switching to fasting, it results in improved metabolism, increased health span, increased longevity. The pathways include rising AMP, reducing cellular ATP, which can result in activation of AMP, and ultimately inhibiting multiple anabolic pathways, stimulating catabolic reactions like autophagy, thereby eliminating damaged proteins and organelles and improving mitochondrial function. Next is decrease in the circulating amino acids and glucose inhibits, decrease protein synthesis and increase mitochondrial biogenesis. Through reduced carbohydrate intake, fasting depletes liver glycogen, mobilizes fatty acids, and stimulates hepatic oxidation. And free fatty acids also activate several enzymes, transcription factors, expression of brain-derived neutrophilic and neurotropic factor in neurons. So intermittent fasting regimens have been targeted, counteracting obesity and maximizing effects of the healthy living by reducing progression to cardiovascular disease and MED syndrome. So description of the intervention. So intermittent fasting involves eating patterns during which individuals take little or no energy for extended time periods, alternated with periods of normal food intake. This implies consuming entire daily caloric intake in a certain time window, say 6 hours, 8 hours, 12 hours, or it may imply eating one day and completely fasting the next day. So during the fasting period, the consumption of calories frequently varies from 0 to 35% of the regular caloric needs. So there are different pathways, different types. One is time-restricted feeding, that is duration of the fasting and eating windows within 24-hour period. And periodic fasting 1 to 2 days a week with unrestricted consumption of food on the remaining 5 to 6 days. Alternate day fasting, 24 hours fasting on alternate days with modified fasting or a restricted calorie intake on fasting days. Next is modified alternate day fasting, degree of caloric restriction or modified fasting during fasting periods. That is, take normal meal for 5 days and fasting for 2 days. And during the drastic energy restriction that is imposed for 2 days a week, it has 2 elements. Food restriction is applied on alternate days and any energy allowed during the fast that is provided in a single meal. So intermittent fasting and weight loss. So we have the visceral adipose tissue, which acts as a paracrine and endocrine organ via adipokine secretion. Adipokines are either pro-inflammatory or anti-inflammatory, and obesity is always associated with hyperleptinemia as well as leptin resistance, and leptin plays an important role through altered signaling of the hypothalamus, thereby it suppresses the food intake and increases energy expenditure. In patients with obesity, there is leptin resistance. That is because of the leptin receptor signaling defect or reduction in the leptin transport via the blood-brain barrier. So the reduction of the leptin sensitivity, that results in excess triglycerides, which is stored in adipose tissue, liver and pancreas, resulting in impaired insulin sensitivity and secretion. On the other hand, adiponectin decreases in proportion to the accumulation of visceral fat. It is a well-known insulin sensitizer, and in fact, insulin decreases adiponectin level, that is hyperinsulinemia. So the beneficial effects of intermittent fasting are due to shift during fasting from utilization of glucose to fatty acids and ketones as the preferred fuel. So intermittent fasting has been shown to reduce adiposity, particularly visceral and truncal. Because of the reduction in adiposity, patient may experience improvements in the leptin, adiponectin level, as well as sensitivity, as well as appetite control. Hyperinsulinemia associated with obesity can impair and decrease circulating adiponectin levels and leads to insulin resistance. So intermittent fasting may lead to weight loss, improved insulin sensitivity, and mechanism of weight loss is related to caloric restriction, increased fat metabolism, enhanced insulin sensitivity, and improved glucose metabolism. During the fasting periods, the triglycerides are broken down into fatty acids, which are utilized for energy. And ketone bodies may contribute to epigenetic control of gene expression, DNA repair, and genome stability. So, intermittent fasting restores the catabolic process that recycles nutrients in starvation and maintains cellular energy homeostasis, enhancing immune system's functionality. Other proposed mechanism includes changes in the endogenous circadian clocks, which regulate the production of metabolites and hormones, such as cortisol, insulin, and glucagon, which in turn affect body weight and composition. And changes may positively affect the diversity of the intestinal microbiome also. So, with reference to anthropometric measures, data taken from the systematic and RCTs in patients with overweight or obesity, fat mass and weight circumference significantly reduced, and intermittent fasting were effective methods to increase the fat-free mass, and LDL cholesterol significantly reduced, and for 1 to 12 months, it was associated with increased HDL cholesterol level. And overall, the key message is intermittent fasting is associated with favorable outcomes supported by high-quality evidence, and longer follow-up durations allow for a more comprehensive assessment. An early time-restricted eating may facilitate natriuresis, the excretion of salt in urea, so it reduces blood pressure. And it can induce autophagy and increase the carriage of the bacterium Akkermansia muciniphila in gut, so favorable influence on the microbiome. Intermittent fasting, insulin resistance, pre-diabetes, and diabetes. So increased adiposopathy, subsequent chronic inflammation, leading to the development of insulin resistance. And intermittent fasting can decrease adiposity, improves insulin resistance through caloric restriction and metabolic reprogramming. And several studies, that is the result of the studies, using the intermittent fasting protocols in pre-diabetic patients clearly demonstrated that 5-week trial of TFR in 8 pre-diabetic male subjects, the subjects decreased fasting insulin levels and blood pressure, improved insulin sensitivity as well as beta cell responsiveness. So the physiological mechanism associated with intermittent fasting includes autophagy improvement, reduction in inflammation, and improvement with reference to metabolism, especially in the adipose tissue, liver, as well as the circadian biology and gut microbiota. Next is with reference to type 2 diabetes. The most used intermittent fasting regimen for type 2 diabetes is intermittent fasting 5:2. So the post-intervention studies showed that weight loss reduced A1C levels and improved fasting glucose and lipid levels. In conclusion, intermittent fasting in any form leads to significant weight loss, reduction in the whole body and visceral fat, and both weight and visceral fat gain, they are associated with increased risk of type 2. And since IF intervention, patients with the type 2 have experienced improvement in glycemic parameters and partial reductions in the medication intake. As no severe hypoglycemic events and no other events have been reported, it can be considered as a relatively safe dietary intervention for type 2 diabetic patients, provided you should completely go through the clinical history of the patient's duration of diabetes, age group, associated comorbid conditions, A1C level, and associated diabetes-related complications. So changes in the body weight and A1C following alternate day. So particular study, you can see the baseline A1C value, changes with reference to body weight after 7 months of intermittent treatment, changes with reference to A1C and body weight. These are all the trials of intermittent fasting in obese patients with reference to various parameters, body weight, energy intake, fat mass, blood pressure, and various parameters of lipid profile, trials of intermittent fasting in pre-diabetes and type 2 patients, including the fasting glucose, fasting insulin, HOMA-IR, A1C, as well as the markers of inflammation. So safety of intermittent fasting. So long-term gastrointestinal adverse effects such as abdominal pain, diarrhea, halitosis, psychological disorders. Prolonged fasting inhibits uric acid excretion, and it leads to decrease in overall energy intake and a deficit in overall protein intake. And despite reduced dose of diabetes medications, fasting increases the incidence of hyperglycemia. So patients on sulfonylurea, it was discontinued based on A1C. Patient on insulin, their dosage was modified, and some of the trials it was totally stopped. Therefore, type 2 patients require close physician monitoring during intermittent fasting. So the safety of intermittent fasting remains inconclusive, attributed to the lack of large randomized controlled trial studies. So these studies were conducted only for a short duration. The sample size was very small, And these patients were followed up only for a short period of time. So we need to have large RCTs. So intermittent fasting and cardiovascular risk, insulin resistance associated with the state of inflammation, including elevated C-reactive protein. And reducing insulin levels through intermittent fasting would be expected to reduce the major adverse cardiovascular events. Lipids, nuclear expression of PPAR-alpha and gamma-coactivator alpha in the liver lead to increased fatty acid oxidation, and there is elevated fatty acid oxidation and decreased hepatic triglycerides and VLDL production. Hypertension, activation of the parasympathetic nervous system has been documented by an increase in the activity of the cholinergic neurons, including the brain-derived neutrophilic factor that is primarily produced in response to glutamatergic receptor activation. Next is the inflammation. The concentration of inflammatory markers are very much reduced. So including the VCAM, ICAM on the vascular endothelial cells. So these are the beneficial and detrimental effects of intermittent fasting on cardiovascular diseases in clinical and experimental studies. In humans, you can see reduction in the cardiovascular risk factors, improvement in New York Heart Association classification in patients with heart failure with preserved ejection fraction failure, as well as heart failure hazard ratio. So intermittent fasting feasibility and modern lifestyle, it is more adaptable and correlates with the natural circadian rhythm. It also improves quality of life, and intermittent fasting strategies are found to be relatively practical in daily life, and evidence documenting the ill effects is sparse. And the reason for caution, some of the commonly reported adverse effects, and it is not recommended for individuals with hormone imbalance during pregnancy and breastfeeding. So individuals with eating disorders and those with dementia have other unique challenges. So adverse effect, potential risks of intermittent fasting, and overeating is an expected consequence, and special consideration needed in patients with mental illness. So dietitian or nutritionist should be consulted to ensure that the nutritional needs of the persons are being met, and physicians training in intermittent fasting is essential to provide adequate information. These are all the unanswered questions and rationale for them. Does the time-restricted feeding during the morning, afternoon, or evening have different metabolic effects? And popular claims, pros and against to intermittent fasting regimen. Next is popular claims, again, with reference to negative claims. Next, intermittent fasting could reduce lean mass, not sustainable, and leads to higher attrition rates, leads to side effects such as nutrition deficiency and lethargy. AD standard of care, religious, intermittent fasting differences and similarities. So, key message, if fasting sounds scary, try to avoid snacking between meals, and especially late night snacking. That can be an easy way to give yourself time for your blood sugar to recover between meals. So, in conclusion, the fasting-related diets, complete alternate day, modified alternate day, time restricted, and the molecular effects of intermittent fasting, and so it has shown positive effects on weight loss, and studies have demonstrated it has a wide range of benefits for many diseases, and in the absence of large RCTs, testing the efficacy and side effects in patients with MET syndrome, prediabetes, and type 2, for extended duration, it is difficult to assess the risk, and studies assessing long-term follow-up are needed for assessing efficacy as a permanent lifestyle approach. Thank you very much for your kind listening.
Thank you so much, sir. It was a wonderful and a very crisp presentation, and I never expected that you would finish intermittent fasting within this time period. So, any questions?
Because I thought this will invite a lot of discussion. So I start much earlier, allowing our participants to interact with me. Of course, I'm not a specialist in this field.
Thank you, sir. Any questions from audience?
Sir, all the time we have been recommending our patients to eat on time, eat, snack between time, reduce the meal size, and now how come suddenly we are talking about intermittent fasting?
Yes, sir. Very important and relevant questions. For the management of patient with diabetes, of course, medical nutrition therapy, I have given the data that is systematic review and meta-analysis tried in patient with the type 2 diabetes, and wherein they have included only few patients. Those patients were followed up. In fact, they have given pure diet meal planning, and most of the sulfonylurea group of agents, insulins were discontinued. Patients were on gliptins and metformins. And they were given the timing for meal as well as the meal plan. And those patients are followed up for the duration of the illness. There was reduction in the weight loss, and in turn, there was reduction in the fasting and postprandial. In the long run, can we extrapolate this to all our patients? I'm not telling, I'm not recommending.
And also, sir, it's not understood properly by our religious people. Probably our elders felt during that time they eat less and it's beneficial for health. But part of the day they don't eat. Afterwards they eat the 24-hour meal or even more than that.
Yes,
And
unrestricted calories intake.
And by the end of their religious period, most of their sugars, A1Cs, everything goes haywire. So
Yes.
it's not understood properly.
In Ramadan, what happens, in Ramadan fasting, what happens, there is a disturbance with reference to sleep pattern. There is an alteration with reference to sleep-wake cycle. Sleep-wake cycle. There is always some amount of stress associated with the disturbance in the sleeping pattern as well as the sleep-wake cycle. That in turn results in low inflammatory state. That results in low inflammatory state. In fact, in some of the patients, they have demonstrated high elevated levels of the CRP also. So that is totally different. That is totally different. That is taking no caloric intake throughout day and taking extra caloric in the night time. That should not be encouraged.
That is not understood properly by our religious practices. Even in our Ekadashi, Dwadashi, eating 5 types of fruits and half-liter milk, they call it Ekadashi. And to compensate that, next day they eat up to the neck. I think it should be made to understand.
So what I gathered information is morning 8 o'clock, cut short before 6 o'clock or before 4 o'clock, or 6 to 4 or 8 to 4, 8 to 6 or 10 to 6. From 6 next morning and 8 o'clock, like that. So keep ourselves, if we keep ourselves away from food for nearly 10 hours, 12 hours, 14 hours, 16 hours, it has got a beneficial effect, that's all.
Congratulate Dr. Shunmugavelu. One small question. How safe is your intermittent fasting in patients on insulin?
No, sir, because in most of the studies it was discontinued. And patients with A1C of 8 to 10, they administered insulin with a modified dose. That is, prandial they have stopped, and they gave the basal insulin 50%.
So now you know, sir, why he practices till 3 a.m. because of intermittent fasting. Thank you, sir.
So my clock, circadian clock, has been totally altered.
We conclude
We
this
request the
session.
chairpersons to give the memento to the speaker. Thank you so much, sir. Thank you, the chairpersons.